So thank you very much for this great walkthrough. I tried to sum it up a bit. So before I open the microphone for everyone, maybe I use a minute for myself to just sum it up a bit. I think this plenary session was meant to focus on where we are going, and it was the medical plenary session where we are going. So we have been speaking about PrEP and in the context and its allies, and I think PrEP is somewhere between an analog and a digital perceive that, first of all, we have to use the analog system with advocacy and outreach and posters and flyers as much as the digital one, as Owen just showed us. We need online services, social networks, and online ordering also to make PrEP available everywhere. And PrEP is also somewhere between the community, and here we have to take care for the insurance, the visibility, the accessibility, and the identity. We have to think about the activists. Where are they? How can we reach them? Do they need more support? And safe spaces, as you also mentioned it, for people who actually need to know where to go and ask when we are talking about Ukraine and Russia. The professions, they need to be aware of the situation. They need to talk about their patients and their clients. They need to address substance consume. They need to address sexual identity and sexual culture, which is mostly not happening because also the professionals are full of shame and also full of stigma. So that's why it's always very important to train the trainer, as actually Michael was also just mentioning it. And we need also guidelines for the professionals so that they know in what kind of range they are able to talk about it. And the capacities are definitely also with the professionals a problem, because most of them say, I cannot talk about sexual identity and PrEP and STDs too much because actually I only have like 5 or 7 minutes to talk about it. So what are we learning? We should learn from the past, what we learned from the contraception and the condoms and the vaccinations, like actually you, Aska, also said it, and also from the community. So what UK is doing is definitely a model for maybe other communities, and maybe we can adapt it for regions where there is actually no reach for Ukraine, for instance, or Russia. And we should always be aware of the different cultures. Yesterday, I really liked from Gus that you made us suddenly gather together in small little groups, just all of a sudden to just talk about it. There was so much coming up from people who actually just wanted to talk about it. So what I summed up was here that we have different cultures with different agendas. And not only that, we have different languages we use. And language, I don't only mean Spanish and Italian. I really mean like a different semiotic. We use shame and stigma different in cultures of people with color, or in cultures where actually maybe more trans people are feeling home. And also the faces should be maybe more broader, that we maybe really address more people. So there is a barrier between the West, I took it in brackets, and the East. So in the West, maybe we should go deeper with where we are going to. Maybe we should really go to the groups, the self-help groups of Narcotics Anonymous, and to the alcohol groups. Maybe to groups dealing with the migrants and trans people. Maybe to schools. We also addressed it today. Maybe we should formulate something and go into schools and educate about sexual health. In the East areas, we cannot go so deep. Maybe in the East, we should go more broad. We should maybe change the faces and not only talk about a blue pill because they are just not available. Maybe in the East, we should talk about what is prevention, how can we prevent, and where do you get information, rather than forcing a blue pill into the community. Maybe we just have to just translate the text and the books we actually work with all the time already. What we didn't speak about is in further options. We only spoke about Truvada now. We didn't address the NNR-TTIs, which is maybe a new version of a PrEP, maybe. It's definitely a new version of HIV medication, where you take only 1 pill a week and then you have a doses for a whole week. Maybe these are new options for PrEP. Maybe a new option for PrEPs are injectables. Probably at the end of the year or next year, the HIV medication is going to change. We will probably have injectables on the market. That means you, as an HIV patient, you go to your clinic and then you get an injection, and it's a depot of HIV medication, and you are done for a month. Maybe this is also a concept for PrEP. Because, and we also didn't address the feminome. It's just one part, like what can we do with women who don't want to take any further pills because they're already we already took all the contraceptives all the time. So I think the rise of a competition is maybe also reducing the costs. This is something we haven't addressed yet. We were talking about how to implement PrEP. Maybe we can formulate guidelines in form of PrEPster tracks, that the professionals are able to deal with new PrEPsters, that they know, okay, you are a PrEPster like you did actually with the Dean Street. It's really amazing that you told them, if you're taking PrEP, you can just skip the line. I mean, this is what we want, right? So maybe this is also a door opener for it. Maybe we can implement something with the professionals to tell them, if your patients are going on PrEP, maybe you can just open a window for the lab and they just go to the lab, they don't even see you, and you just talk on the phone about the results. We should think about those kind of things. And self-testing is definitely also an option. So I would like to address those kind of things. Maybe we can use them, and I open the microphone. Thank you very much.